So allergic rhinitis, the clinical presentation is with sneezing, runny nose, congestion, postnasal drainage. Any of the symptom or a combination of these symptoms. These symptoms happen because of histaminergic response in the nose and the sinuses, sometimes in the eyes and the throat. So sneezing is a manifestation of histaminergic response due to underlying allergy to the environmental allergens, be it outdoor allergen or indoor allergen. This is not normal. So this is a manifestation of allergic rhinitis, which is a clinical condition which needs to be evaluated by identifying the root cause of these symptoms, treating appropriately with medication, and if feasible, doing the sensitized allergen avoidance measures.